So the idea of a consumer path to purchase is something that retailers have understood is really important for many years. And is a concept that as healthcare providers think more about how to behave like retailers in the future is something that's going to be critical for them to understand. Now, like many concepts from other industries that we try to translate over to healthcare, there are more complexities that get introduced when you talk about healthcare. And so, as opposed to a gallon of milk, where there's a pretty straightforward path to purchase for the consumer going to the store, choosing which milk to purchase, and following through with the purchase, we have to think about the consumer path to purchase in healthcare at two levels. First, around the network decision, and then around the service level decision. And when we think about the network level decision, we're thinking mostly about how much choice is the consumer willing to give up in exchange for price benefits. And then once they make that network decision and potentially choose a narrow network, they may have less choice in which services and which providers they choose going forward. For those that do want that choice and want that access to a lot of different providers, choosing an open access plan will allow them to really have that service level decision making to come into play. And when we think about the service level decision making, the path to purchase really comes into play in a meaningful way. And so when we think about that concept in healthcare, really it's about incentives and criteria being in place for a consumer. And so it may be financial incentives that come into play because of a high deductible plan or reference-based pricing. There may be other criteria besides price and financial incentives that come into play. Quality, access, and many things that we may have not even thought about yet in relation to healthcare because consumers traditionally have not been activated in the space. So once the financial incentives are in place, it really is about information being available to individuals to make decisions. And that information may come from a variety of avenues. A good transparency tool may be one important way that consumers get access to information. For those that don't have a transparency tool or may not be as wired today, some may still want that information directly from their physician. They may choose to access that information over the phone, talking to their hospital provider or their physician office. Or they may choose to access it through a mobile application or the hospital website. And so thinking about, from a provider's perspective, how we intervene at these steps along the process of the path to purchase for healthcare consumers will be really important. And so once the incentives and criteria are understood and the consumer has that information in place, it really is about activation. And so not all consumers that have the incentives and have the information will actually go out and shop and make decisions about their health care. Activation is an area where transparency providers have been spending a lot of effort and a lot of attention recently. Folks like Castlight have really thought about how do we take these consumers that now have incentives and information and really get them to shop for care, therefore saving money for their employer clients. So for instance, Castlight has introduced a rewards program to try to incentivize the employees of their employer clients to shop for health care. Change Healthcare is another example of a transparency provider. And what they've done is send out proactive email alerts to, for example, an individual that may have had a level 1 emergency department visit. They may send out an email alerting that consumer to all of the urgent care sites in that vicinity and how they could have made a different decision and potentially saved themselves and their employers money in the process. And then once they're activated, are the consumers actually making a different decision than they would have otherwise? So it goes from incentive to information to activation, and then is there actually behavior change at the end of that path? And what we're finding in some of the research and early returns on consumers shopping for healthcare is that behavior is changing. And that change in behavior will have massive implications for healthcare providers in the future.